people may fall on the outstretched hand and arm, and it's given a name, foosh, fall on outstretched hand, right? But what makes the impact initially was the ground force into the wrist. So nobody looks at the wrist because there was no complaint. Nobody looks at the elbow because there was no complaint. But because the source of pain was here, everybody closes their eyes, zooms in, and considers that sniper specific. No, that's like a shotgun approach. What caused the shoulder to become? Oh, I don't know if you just saw that. That says
Who was the very famous person who texted him during our interview? You got to watch to find out. Check out Dr. Mitch Mally, Extremity Expert. Dr. Mally explains how he became so successful, the steps you need to take, and how he wants to help get you there as well. I'm Michael Uriarty, or Dr. Mike, and welcome to episode 51 of Technique Talk, the MYK system, and more. Check out the notes below for more information on Dr. Mally, his clinic, and his classes. Subscribe, like, and definitely share this video. Let's dive in. All right, Doc. So tell me, what actually got you interested in healthcare?
That's a great question, Dr. Mike. I've had many injuries being in sports to the level of professional sports and didn't quite make it to the bigs because of a devastating knee injury before tryouts for the Detroit Lions. And, I was 30 credits shy of going to med school as well to become a orthopedic surgeon with a fellowship in sports medicine, a chiropractor at the two-hand touch football game that I was insisted to play because of Mitch turning pro. I decided that, okay, I'll go ahead and I'll play one or two downs. That's it. First play of the game, kickoff return, plant the cleat, accelerate the opposite direction, and the cleat stayed in the ground and dislocated and tore every ligament cartilage in my left knee. And ironically, my two older brothers, biochemists and PhDs and masters in immunology and biochem, and we all grew up knowing chiropractic was quackery. Well, on the field, as God would have it, there's a chiropractor. And the guy says, look, I don't think it's broken. I think it's just dislocated. He straightened out my leg. Before you have surgery, come and see me. I got a sports medicine guy working for me. I'm in shock. So I go to the hospital. I get a air and dye injected. At that day, it was called a pneumoarthrography. In English, they inject air and dye, and then they have a television screen called a fluoroscope, and they move your leg around. And it was determined I tore everything: ACL, PCL, medial lateral collaterals, meniscus, both sides, everything. It was a total deranged knee. And it was like, if I don't have surgery, I'm not going to play pro ball. So I elected not to have surgery. I went to this guy 5 days a week, and I'm seeing people coming in bent over. I'm seeing people with necks like this, walking out happy, people in pain, leaving, feeling great. And I'm going, what is this voodoo? What is this? And I started asking the doctor some questions, and I'm like, wow, that's amazing. And I was just seeing outcomes that were atypical in the medical model. And that's the way I was raised. So I became extremely interested in this profession to the point that I dropped out of my pre-med program, 30 credits shy of going to med school and graduating, and I matriculated immediately into Palmer. And back in the day, you needed 2 years. I had 4 years and just 30 credits shy of med school. So I had quite a background, and it was pretty easy to get matriculated in. And thank goodness they took me. And here I am specializing in the mere thing that caused me to become a doctor.
Right, right. So, did you grow up in the Davenport area or was this somewhere else?
No, I'm a Detroit native.
Oh, so you're Detroit. Okay. And then, so how did you choose Palmer as the school?
Palmer was originally known as the Fountainhead, and chiropractic in Davenport, Iowa, September 18, 1895, was founded by the Palmers. And as a result, I wanted to go where the best was. And the school was so young, it was 80 years young, the whole profession. Not dating myself, but yeah, it was it was a young profession, so I wanted to go where the best of the best would be and see and explore this new profession.
So what year did you go? What years were you in there?
I matriculated in, I started in 1978 and graduated in 1981.
Okay, okay. So that was back when it was still fairly cheap to go to school. Because it definitely raised in price by the time I got there in the 90s. And then my daughter's in right now, and it's unbelievable the cost of school now that these kids are going through. All right. So as a chiropractor at Palmer, well at all the chiropractic colleges. I'm not going to say just Palmer, but we're taught extremity classes, and they show us here's how you're going to do the ankle, and here's how you do the knee and the shoulder and all that. And I remember I was in clinic, and one of my first patients had an ankle issue, and so the doctor was like, go ahead, and I'm like, yeah, I've had extremity class, and so I went up and nothing. And I was like, this isn't really working. He goes, no. And he came over and he did this move. And so the patient left, and I go, how did, what's that? They don't teach us that. And he goes, I went and took Mitch Mally's class. He goes, you got to go, if you want to learn how to do extremities. He goes, the stuff they're teaching us, He goes, go take Dr. Mally's class. And so I did. And I've been using your stuff now for over 30 years, and it works. And it's unbelievable. So how did you're kind of known as the doctor's doctor in Davenport, Iowa. And so, how did you kind of go? I know from your experience, but how did you kind of go from what they taught us, spine adjusting and all that, and then really getting into the extremity stuff? Was there a step involved in that?
Well, being the athlete that I was and the injury that I had, and observing what the chiropractor treating me was aware of, asking all kinds of questions, there was actually only one or two courses in extremities off campus. That was it. So I come charging in like a raging pre-med kid ready to become an orthopedic surgeon. And I ended up just frustrated by taking all the courses I could take in soft tissue and hard tissue and a lot of extracurricular courses to realize that none of the questions I was asking really had valid answers. And my two older brothers, again, as research scientists, was a double-edged sword. I say, boy, this stuff works. And they said, prove it. There was little to no research, as you know. So I dove into what I knew best, the medical model. I read Journals of Orthopedic Review, American Academy of Orthopedic Surgeons, every medical journal that I could get, every textbook relative to medical of these particular conditions of the peripheral joints, the extremities. As a result, they understood mechanics, but they knew nothing about correcting this in a non surgical, non medicinal manner. And physical therapy is another topic. I love physical therapists, but you know that you don't take a car with a wheel out of alignment, race it on a track to think it's going to improve. And many times, as you've seen in a over 3 decade practice, many of our patients who've tried and been to physical therapy may not have the best outcomes that they really want. And as a result, they search other options and alternatives. When they come to a specialist dealing with extremities and understands joint mechanics, it's the fact that muscle is stupid, nerve controls muscle. So if you get the joint functioning properly, enhances the nerve and blood supply to the muscle, that will aid and abet in the muscle recovery process with the physical therapy. But joint manipulation is way better than joint mobilization.
So you had a couple classes at Palmer, then you did all the research.
No, 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 no. Let me correct you on one thing. Extremities was illegal. It was not taught at Palmer College.
Oh my gosh.
If you were caught doing any extremities or any adjustments outside of school, you were thrown out of school. You were expelled.
Oh, wow. Okay.
When it
Okay.
came to me studying and doing everything on my own to develop my own techniques that are medically evidence-based researched techniques, it's the only one of its kind in the entire world in the profession. And as a result, the dean of the school and clinics would call me privately and say, "We've got somebody in the other room with a knee that's dislocated or an ankle, blah blah blah." and they would want to leave the room. And I said, no, 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 no. I'm bringing in a fellow student, and you're going to stay in the room while I treat that patient. Afterwards, they gained respect to me, and it was wonderful because they actually were searching for somebody that might be able to help these people coming to Palmer clinics. And I've had some absolutely incredible cases when I was a student, wet behind the ears, and the
Wow.
outcomes were through the roof.
Wow. Wow. So that leads into you've built your clinic. I saw I was reading a little bit on the internet. You have is it TriMed Health? Uh
TriMet Health and Wellness was
TriMed Health and
originally,
Wellness. And it's
yeah,
like
originally, I'm sorry,
no, go ahead. Go ahead.
originally created for the triangle, which is the most impermeable shape in physics, which is a multitude of triangles through the whole entire human body, not by coincidence,
Oh,
by design.
yeah.
As a result, I have triangles within triangles in my logo, which is TriMed, was because I developed a multidisciplinary office, chiropractic on one leg, medical on another, physical therapy on the other, and the inside of the triangle would be held together by clinical nutrition.
Nice. And then I saw that it's like a concierge service. So you could have somebody come in for, I think I saw like 5 visits or 10 visits or 15 visits over possibly just a 5-day time frame. So you're doing multiple treatments in a day.
Yes,
Yeah.
yes, that's my VIP concierge care program, which is trimedvip.com. They're 3 day, 5 day, or 10 days of care, depending, that's the minimum. And it's 3 times a day treatment that would include anything from diagnosis, imaging, x-rays, etc., 3D analysis, and all the treatment that we do from soft tissue, hard tissue, rehabilitation, customized. And we have stars, celebrities, and people flying in from all over the world for this VIP program. Because look, when you're struggling and you can't get well, heck, people go to Mayo Clinic to get answers. Well, this is a Mayo Clinic of chiropractic in a way, is that we have patients traveling from all over the world here. I've had people from Germany, from Israel, from Norway, from Denmark. It's just unbelievable.
Well, I know you sent me a video just recently of I think the guy was from Texas, if I'm not the wrist guy.
Yes,
and
sir.
and he drove up and he had been hurting for a while, and then he goes, by far the best decision I've made is to come up here, and he goes, it's gone. He goes, I'm fully functional again in just this little short time frame.
Thank you for bringing that up, Dr. Mike. I got to think back to that one. He was a lieutenant in a firefighter, and he's been off work since July. And he just wrote me yesterday, in fact, ironically, that he says, thanks to you, I'm back at work already. And he's been off since July. He was under my care for what, 10 days,
Yeah.
30 treatments in 10 days. And he's back to work because all other chiropractic failed. And you mentioned that we learned extremities in school. So I'd like to digress and tell you it was illegal in my day. Eventually, it became a class, and rudimentary would be a good word. And
Yes.
many, and you'll get this immediately because you've been through my courses, Dr. Mike, many people liken the analogy to other courses being like infantry, and my courses being like the sniper. And that's my nickname is the sniper, and among other things I don't want to say, but uh, Uh, it's about the decision for precision, and we need to know why we're doing what we're doing. And I almost quit chiropractic 5 times while I was a student because I got innate for the answer, and there's much more.
Yeah.
And I'm totally about innate. I'm 100% about the vitalism, but I'm also again very straightforward when it comes to structure equals function. If it's not functioning, you got to look at the structure. And while they teach us the spine above, down, in, and out, that's called the efferent, which means from the brain down to the other areas of the body. I teach something that's not taught worldwide is the afferent, how the peripheral joints anchor, your shoulders and your legs anchor to the pelvis and spine. So if a spine, I always ask the question, if the spine is having a problem and we correct the spine, why haven't we looked at what's causing the spine to have that problem? So the extremity, like an old shoulder injury, you don't suffer today in the shoulder, but you may be experiencing pain in the neck and upper middle back, that which the shoulder anchors into. So it's really part of the real good, what I call the history or the historical recapitulation, putting together the forensics of the problem. Everybody can see the weed and treat the weed. I look for the root of the seed.
Nice. I like that. I like that.
Thank you.
Um, so, all right. So this leads into my next question. Looking for the root of the seed. So your Malley method kind of flips the script on what they kind of drill into us and stuff in school. And so, is there an evaluation step that uncovers a hidden extremity issue that maybe most DCs or other practitioners, usually miss or may miss?
A lot of what we were taught in school was about the history gives you about 90 to 95% of what you need to know and do. The remaining will be from your exam, x-rays, imaging, etc. I find that more true today, 45 years in practice. I do a comprehensive, and I mean very detailed, history, and my staff that take the history now know what to go through to do the prelims. I come in and fill in the blanks of anything I really know based on 45 years of clinical experience. If somebody's suffering vertigo or tinnitus or tinnitus, right? The normal, typical chiropractic is look at the cervicals, occiput, upper cervical spine. Not many know the corollary between temporomandibular joint dysfunction, TMJ, and vertigo, tinnitus, sinus, ears, eyes, nose, throat, equilibrium, balance, etc. So I'm going to be asking questions instead of just about where's the headache, can you point to it, how long have you had it, how long do you suffer? My questions are going to be a little bit more detailed. When was your last dental exam? Since this joint right here can also contribute to your symptoms, so I educate the patient, which now allows me to go into further detailed questioning, disclosing or evincing, proving that the TMJ that's been overlooked, undertreated, that's affecting millions of people, has afflicted this patient in a way they didn't even comprehend.
So I want to say something about the TMJ. So I've had a handful of patients that came in with TMJ, and I was like, oh, I learned TMJ from Dr. Malley, and I would have to get your books out. Okay, let me see. How do I eval? How do I treat again? And then I would go do it. And so just recently, I would say, maybe 6 months ago, my wife came home and she's like, man, my jaw's hurting. It's starting to get stuck. And I go, I got a treatment for that. And she goes, all right, what is it? And I go, well, give me an hour. I go, let me go, let me go. So I got your books out. I don't know. I'm sure your material has changed, but my information of yours is in a 3-ring binder. So that takes us back any length of time for you. But so I got that out. Again, I just read through it. Your stuff is laid out so well. And I just read through
Thank you.
those certain pages and I'm like, okay, here's the eval. So then I did the eval on her and I said, oh, this is the adjustment you need. I did it. She got a clunk, clunk, and all of a sudden she's like, oh, it's gone. I mean, like that, it worked. And I've done it. I've had to do it a couple of times with her, but her symptoms, her issue is gone now. And so for that, I got you in person. I'm going to say thank you for that because
You also got out of the doghouse for a
I
minute.
did absolutely, absolutely. That helped me out tremendously.
Fantastic.
So yeah. So
Congratulations.
how did you get into the TMJ? Is that how did you
Well,
think to look at?
it's it's really another great question. Look, there are 9 extremities in one spine: shoulder, elbow, wrist, hand, right? Foot, ankle, knee, hip, and TMJ. Those are your peripheral joints. You give me $1, I give you 9. Would you ever stop?
Right.
So, from a business perspective, I have two philosophies. If you're going to do that which everybody else does, do it better. How about why not doing that which nobody else does? And then if you're terrible, you're still the best. So I evolved with a big full skeleton. I think it was like $800 in the day. And I used to dress it up with a white clinic jacket and a tie just to horse around. But I spent thousands of hours palpating the spine and all the peripheral joints. First, by looking at it. Second, by putting a sheet or a pillowcase, and then eventually a towel and eventually a pillow over everything I palpated. That's how I spent my time, not in bars, not going to party. I did a little bit of that, to be honest, very little. I spent a lot of time in the cadaver labs, and I spent most of my time in the medical model in those books and journals, so that everything I cite, like I was the first and only chiropractor ever to be invited to speak at General Motors by the medical director of all of GM on cumulative trauma disorders. So you got to imagine, here's a chiropractor in front of board certified surgeons with a fellowship in hand surgery, shoulders and spine, etc., for all of General Motors. I'm on fire, Dr. Mike. I'm telling them, you guys know the Journal of blah, blah, blah. And I just go right through everything, right? And Thomas and Fullerton, Neary and Sunderland, Castelli, Evans, Press, Armstrong, Silverstein, you guys know New England Journal of Medicine, right? Well, they say boom, boom, boom. Well, I'll tell you what, it was so much fun that on the way out, I had six surgeons, top surgeons, want to go in the limousine to take me to the airport. And I don't mean after the first 5 minutes on stage. I meant after I was done. And they asked me all kinds of questions, and they were honest, boldly honest, Dr. Mike. They said, look, we don't know any better. That's just the way they taught us in med school. If you have a carpal tunnel syndrome patient, if you cut the ligament, you create more space. The problem is it's paradox. When you cut a ligament, it widens the canal by 7 to 20%. You and Farrell's article, okay? Journal of Hand Surgery, Journal of Bone and Joint Surgery. When it widens the canal, you end up with scar tissue, the paradox, which is thicker than the original tissue. And the number one reason for re-ops is they have to go back now and cut out scar tissue. And another funny obstacle. Why do they tell you to put the hand in a cock-up splint, or some of the exercises which tell you to stretch the hand back, if you know what I'm going to share with you? There's 2.5 millimeters of mercury pressure measured in the carpal canal with the wrist in a neutral position. When you bend it, it's 32 to 35. When you extend it, it's 50. So why are you telling people to add more pressure to an already occluded or reduced canal size? That's part of what I do. So one of the other funny stories that I'll share with you,
Oh, you
sorry
go.
about that.
No, you're good.
I just had another call coming in on a VIP case.
Oh,
But no worries. I'll get back to him. So, one of the funniest stories is when I share the information, it's not to denigrate another profession, and it's not to denigrate the sloppy mediocrity of the infantry. It's to one up, it's to better ourselves as a profession as a whole. All the research in 45 plus years of clinical experience, plus my 3 years of Palmer, 3.5 years, led to the discovery of ways of fixing people that's unprecedented, yielding unparalleled outcomes in the fewest number of visits, which is the way I'd want to be treated. Look, the Bible even said it, do unto others the way you want to be treated.
that's right. That's right. Yeah. And I agree. We want to try and get somebody out of pain and moving as fast as we can because otherwise they're not going to want to come back. Why would anybody keep coming back? Yeah,
The saying in the Bible did not say, do unto others the way you want to be mistreated.
that's right. That's right. All right. So you gotta have just in the few conversations that we've had, we've texted a few times and but I was even on the phone with you one time, and you were like, "Oh, hold on just a second," and you're saying goodbye to somebody. You're like, "Yeah, yeah, yeah." Anyway, that guy's a Hall of Fame guy, and so and
Mhm.
I'm like, "Good Lord, he's just treating all these people." And you've mentioned some of the names that you've treated. I'm not going to say them, but you got to have a couple stories of some people. I got to assume that we could bring up at least one.
Well, okay, I'll give you two right now, just off the cuff. And I
Okay,
even sent you a picture because you and I were texting while I was at lunch with a pro football player. That's
correct.
in a television program right now. Chad Powers, I don't know her name. It's a television program on Hulu. Okay, and that's a football player, Kevon Rudd, and you're familiar with him. And the MMA fighter first to be in the Hall of Fame is Jens Pulver. That is also he's on my Instagram, and that's the Mally Method, Mally, the Mally Method. And you can see him, and he comes in yesterday. He says, "I'm ready. I need it again, real bad, and you're the only man on the in the world that can do this. So please." So I go ahead and my hand speed, as part of the precision I'm known for, is speed and precision. And I gave him an adjustment, and he gets up and he goes, starts laughing. It's just hilarious. He goes, "That's why I come to you." He says, because nobody can move him. His neck, he couldn't turn his head. And if you watch on the internet, you'll see a lot of very, very interesting maneuvers. We'll just say it that way.
Oh yeah. Oh yeah. Yeah.
You'll see people turning a head. Well, what are you going to do when a person cannot turn their head? Or you're going to do a TMJ and you see people taking their finger in the mouth, and the mouth is wide. People can't always open their mouth. In fact, I jokingly from stage say the only time I'm ever going to put a finger in a mouth is if you owe the office money. All right, so there is no reason for that. Look, the anatomy proves that putting your finger in the mouth, the lateral pterygoid release is number one, not a gentle maneuver. And number two, with that pressure, you have to know your neuroanatomy. Just beneath the lateral pterygoid muscle is that little pinprick hole called the foramen ovale, through which the mandibular nerve trunk of the trigeminal nerve comes through. So applying a light pressure would obviously better than putting a deep pressure that's going to potentially involve the trigeminal nerve and injure it as well, the largest of all 12 cranial nerves. So the public needs to be aware of who they are selecting to go to. And if this person says they specialize in, find out who they were trained by, how many cases of comparable types have they treated, and what were their outcomes. We're an open book here, 45 years, VIPs. We have a wall of fame that's, well, actually three walls of fame. But these are just from people that are just like you and me. They're in the spotlight. They have a lot more zeros at the end of their names, and they want to pick the best of the best. Well, it doesn't matter how much money you've got. You should still always want the best outcome for yourself.
Exactly. Exactly. So that leads me into I was talking to you earlier about your classes, and so you had mentioned that you did a lot of research and all that to develop your information. And I can attest, when we were in the class, you have research articles after to back up what you're saying and what you're doing. And so that's really good, because I agree with you. That's not always the case when you go to the classes. And so just a couple of questions on your classes. First of all, you still teach. Are you the only one that teaches on your technique, or did you train some people?
The ones that I train, as you know, are my interns, student interns. That program, they come in and assist, but I'm always overseeing. I am the main and only teacher.
You're the
They
teacher.
assist me with the number of people in the class,
Okay.
helping with the techniques.
What professions do you teach?
Well, I've spoken obviously to many, many orthopedic surgeons, such as General Motors. I've spoken to physical therapists. I've spoken to dentists when I was in Norway speaking on TMJ, one of 10 or 11 trips speaking in Norway. They asked on the TMJ, could we invite dentists? So there was a room full of about 55 dentists the night before I taught the clinical part.
Wow.
And there, I asked them, I said, what do you guys know about TMJ and do you guys treat TMJ? And the average of the audience went like this.
Wow.
No, we were only taught the anatomy. And what we think that they understand and know about TMJ is far from the truth. So what they actually said is we were taught just the anatomy of the TMJ. So we would send somebody to a TMJ specialist. I said, what exactly is that? They say a dentist that took some courses. So I said from stage, and I still say it to this day, my message to dentists is I promise not to work on teeth if you promise to leave the most powerful, most dangerous joint in the human body, leave it to me to deal with, or us that are trained under this technique.
Nice. Nice. So, I know you just got back in town because you and I were trying to set up on when we could have this conversation. And so you just got back in town. You were gone for quite a while. Was that Norway or was that somewhere else on this
That
past
was in
trip?
last week was in Barcelona, Spain. I was there, left here Tuesday, arrived Wednesday, naturally, 7 hour difference, 7 hour flight. And then I spoke Thursday at the Chiropractic College in Barcelona. And then I spoke 9 to 6 on both Friday and Saturday and was home in bed by 10 p.m. Sunday.
Wow. Um,
And
yeah.
usually the weekend seminars, I'll fly out on a Friday. I have private offices that fly me out. When you ask me who else do I teach, I've spoken to physical therapists, to dentists, to orthopedists, to medical doctors. I used to work, my office was in the outpatient surgical center in Davenport. And I was there for about, 12 years, I believe it was. And then I moved out when another company bought the property and up went the rent. So I definitely, it was time for me to move on again. So presently, I would just recommend that people that want to have this type of specialized care do your due diligence. I'm sure that Dr. Mike, you'll provide my contact information should any
Absolutely.
listeners from students to chiropractors all over the world. Been to many chiropractic colleges teaching students, and then I've also been to tons of state associations. This last weekend, I was speaking for the Georgia Chiropractic Association. So I go in, I speak, I excite the audience, motivate them. I do demonstrations showing miracle after miracle and things that people don't even think about. For example, in England, I had a guy who couldn't raise his arm past here on a test that should be Mason's, that should go all the way over his arm. This MMA fighter said, "It's been 13 years. I can't raise that arm. I can't use it." Wow, that's interesting. What have you done? He said, just MMA and chiropractic. I said, okay. Well, typical, since I've had 50 years of varieties of martial art training, and I've seen so many and treated many, many stars and celebs who are martial artists on TV, etc. And you learn that people may fall on the outstretched hand and arm, and it's given a name, foosh, fall on outstretched hand, right? But what makes the impact initially was the ground force into the wrist. So nobody looks at the wrist because there was no complaint. Nobody looks at the elbow because there was no complaint. But because the source of pain was here, everybody closes their eyes, zooms in, and considers that sniper specific. No, that's like a shotgun approach. What caused the shoulder to become? Oh, I don't know if you just saw that. That says Lou Ferrigno. Remember the Hulk?
Yeah. Yeah. Yeah.
Yeah, I've
Yeah.
been treating Lou for 45 years. He just wrote me something just now. He's over in Minnesota right now at the Elton John concert. So, yeah, 74 coming up November 9th. I've been treating him for 45 years, my closest male friend, and we're in touch a couple times a week for 45 years. After fixing something nobody else could fix, and I can go on record, I have his signed autographs and everything for all these years. Lou had an Achilles tendon problem, and they were going to cut his Achilles tendon and scrape and so on and so forth. I set his calcaneus in one treatment, and the paradox of that is watching him get up and turn and look at me and says, "That's incredible," right? The Incredible Hulk,
That's
and
good.
we've been friends ever since. I don't ask him for anything other than anything you need, Lou. I'm here for you. Okay, and the list goes on. That's why I don't advertise who I see, and you were very professional in the way you handled that question because I don't want to be a name dropper. There's so many people right now. The internet is full of people just showing off who they're treating, and I think they're entitled to their privacy, and I respect that.
Right. Right.
It's not who you treat, it's what you do for them that has them come back.
True.
Okay.
True. All right, so I'm going to go back to your classes real quick, and just so people understand the time frame that Doc and I got together, it's 7 o'clock in the morning, and so Lou Ferrigno's texting him very early, just to give a little relevance there. So for your classes, do you? I know you teach in Davenport. I mean, as far as your 2 day class, are they all 2 day classes, or are they, or one
Well,
day classes,
a
or
lot has changed in 3 decades for
yeah.
you. So I teach Tuesday nights for the student as an optimal night, and I speak from 5 to 6, training my interns, just reviewing with them some grand rounds and what we're going to talk about, and make sure their techniques are spot on for that day. If I'm training doctors students on shoulder, then we'll rehearse everything and just make sure they're spot on 100%. And then the audience comes in from 6 to 9 p.m. And that's a series of 5 Tuesdays. And then they receive an exam. In your day, I would give my lecture and then the hands on.
Right.
Currently, because of technology, my lectures are online. So
Oh,
they have to do the online portion, take the self exam, score 80% above, show the gold seal in order to take the final exam 5 weeks later, which is oral, practical, and clinical. So we've really created a masterpiece of training.
so somebody could be in another state and do all of this pre-work and then come to you for that certification part.
Yes, but that's not typical. I
Oh, okay.
usually would end up, doctors can fly anywhere around the world that I'm teaching and attend courses that way.
I gotcha.
I do go to many chiropractic colleges, and we're always looking for a student liaison that we can give a scholarship to our course by them being present in their classes, spreading the word, and getting a group of students of 25 to 50 or more students. And I'll fly in as many interns as I need so we have number of intern to student or doctor ratio. In New Jersey, I had 12 interns come to New Jersey for 200 doctors that were taking my course. So
Wow.
I do everything from private one-on-one training to my live grand rounds experience where doctors fly in on a Thursday night and they train Friday and Saturday. They fly home, and that's a private training program. I have a standard 2 year fellowship program, which is 4 trips to the office times each year for 2 years, 24 months of weekly coaching and accountability calls. And then naturally, people want things quick. So I then created a accelerated fellowship for a 1 year program, which is 6 trips. So it's every other month coming here for a particular region of the body. So the elbow doesn't take as much. So I move the elbow in with maybe wrist or shoulder. I'll move the knee and hip maybe in with foot and ankle. So I'm able to reduce it and make that fellowship a 1 year training and then an examination. And they are now a fellow of Dr. Mally's Mally Method. And they are recognized and receive referrals on their in their area of the world.
Oh, that's nice. That's nice. So, do you go through the process? Because I know there's paperwork involved in order to get a class approved for continuing education hours and stuff. Do you go through that process, or do you just have people, or do they just come and take the class because they want to learn the information?
Both are correct, Dr. Mike.
Okay.
Both.
Okay.
So like Georgia's Chiropractic Association, when a state association puts on an event, they
They
provide all the CEs,
they approve it. Yeah.
right?
Yeah.
When a group like I'm going December 5th, I'm hired to go to Washington, D.C., and I'll be picked up 15 minutes later. I'll be in a Virginia office of a doctor that owns multiple clinics. He wants me to come in to excite his associates about extremities, and then he's going to want me to train each and every single one of their doctors. And there are other businesses out there from the Wellness Way and Cairo One and other groups that bring me in to train their doctors to become more expertise or more clinically experienced in the extremities because it's a tremendous value. And there are very few chiropractors that truly know and understand the sports medicine and occupational medicine part, which is 99% extremities. Let's face it, in basketball, you see foot and knee. Okay. In football, you see foot, ankle, and knee, maybe some shoulders, right? Clavicles. But you don't see, thank God, many spinal injuries in sports. And if they are, they're usually beyond what you and I can deal with.
Right. Yeah.
Okay. So why wouldn't you want to know 9 extremities that affect one spine when you were already drilled in school well enough how one spine can affect 9 extremities? I was taught a saying, and you can fill it in, Mike. I'm going to give you a test. What goes around?
Comes around.
There's the difference between the efferent, what we're taught from above down, to what I teach below up, outside in. I've learned it's not a roof quake, it's an earthquake. And I've also learned that the building you're sitting in, and I am as well, started by an architectural rendering, which in our world, you and me, that would be a thorough assessment, exam, history, x rays. And now we can begin by building a solid foundation. And our foundation begins at our feet, not our pelvis.
Right. Yes. Yes. Well, I can see, Doc, I can see with that explanation that you just gave, the physical therapists, the athletic trainers should all get this information.
Yes, they should, but the adjustments do not belong in their hands. The athletic trainers, when I lectured at the Blackhawks in Chicago,
Hmm.
I was in their training room teaching the National Hockey League chiropractors. And it was ironic that the Blackhawks trainer had never had done what he saw me doing. So I said, "Would you like to lay down an experience?" I set his ankle, and it was kind of funny to watch everybody look at him getting up and go, "Wow, what was that?" And the trainer looks at me, says, "What was that?" And I'm sitting there. There's already NHL chiros, and they don't do this necessarily, right?
Right.
But that doesn't mean that they don't provide the proper care. The words of an athletic trainer at the highest level of professional sports is, you chiropractors, we all have to stay in our own lane. But how do they know our lane if they haven't reached out to know that there are people experienced? Like Tennessee Titans flew me out twice to take care of because the chiropractor said, I can't fix these guys, but I know somebody that can. Okay. I'm not going to talk about the Dallas Mavericks. I'm not going to talk about other teams, etc. I will tell you with certainty, I'm as grounded and down to earth because I'm humble knowing the good Lord gave me great skills to share with other people. And if you can teach a man to fish, he can fish for a lifetime. And I also say the same for every student in chiropractor that wants exclusive elite expertise. Sniper precision, you don't just belong to an infantry, you go to sniper school. There's plenty of infantry courses out there. You and I see on the internet all the time boasting it's the best courses they've ever taken, etc. And you look at the techniques, and it's nothing more than what you saw at school. What I
True.
teach is unique, it's authentic, and it's not taught anywhere else in the world.
And I would agree with that because I haven't seen anything else out there in the 30 years that I've been taking classes that's anything close to what you teach. So I can concur. So
Thank you. Appreciate
what
you.
what would you say? This is my last question for you. So for new students getting ready to graduate or people that have been out for maybe just a couple of years, I mean, granted, this can go for anybody, but I'm talking about the new kids coming out. Is there any advice or anything so that they could build a tough case clinic practice like you have where you're seeing these people and they're coming in from all over? What's some advice for some of these young kids on the direction or
Yeah, that's really, really fair. A very good question. Dr. Mike, I think what should compel students as well as doctors is to do that which nobody else is doing, to offer and provide greater services. You know, people today, no matter what job, if you're a gas station attendant, you work at Costco, or you're a chiropractor or a medical doctor, you should want to provide the best that you can. And people want increased revenue. How many times do your staff say, I'd like a raise? Okay. Well, we don't get a raise unless we get greater outcomes to generate more people. Well, so you got to ask your staff, go get more people and we'll give you a raise, right? All right. So, what would compel anybody listening to this is to want to become the best of the best in your area. Don't blend in with 1,000 infantry, because when the infantry's pinned down, who do they ask for? Hey, send the sniper. We're getting nailed here. So they send for the sniper, the guy that can get the job done. Why shouldn't that be you? Become the leading extremity expert in your community. Become the go to doctor. Learn the Mally method. These techniques are evidence based, scientific, and I speak all over the world. Get your state association or a group of doctors together, or even solo if you so desire, for me to train you, your team, your doctors. then you reach out to me, and Dr. Mike will provide my Instagram, my YouTube, and my cell number. You're welcome to text me. Do not call, just text me, and we'll schedule a conference call. Don't email me because I've got 30,000 emails to go through and to clear up because it's just crazy. It's a wonderful thing to be illuminating, understanding, and compelling to want to be all that you can possibly be. Look, don't ever stop on one rung of the ladder unless it's the very top one that your maker is taking you home because you've reached a level he wanted you to reach. In my world, I'll continue. My wife says, "Will it ever be enough?" What is enough and whose terms? There's still people out there going in for unnecessary drugs and unnecessary surgery. My dad died at 48 going in for gallbladder surgery from a doctor that went to play cards and failed to come back because the nurse paged him 5 times and said, "Nurse, just give him oxygen, I'll see him tomorrow." My dad said, "This is ridiculous. For a gallbladder, I'm going to go get out of here." Goes to get up, blows a clot to his heart, and it's dead. I was 18. Now,
Wow.
is that the kind of doctor you want to emulate? Or what you're listening on Dr. Mike's great podcast shows here? You're listening to an opportunity to meet people who are doing other things, people that should compel you to want to be all that you can possibly be. Join my army of snipers in training. Go to extremityexperts.com, peruse that site. It's always going to be updated as well. And if you have any questions, you can reach me at my cell number. Dr. Michael provide later on or earlier in the show when he edits.
Yes, yes. Well, Doc, I want to say I can see why you are so successful because I've spoken to you a number of times, so I feel like I have gotten to know you a little bit even before this conversation. But now, even in this conversation, I've gotten to know you a little bit better here, and you're a humble guy, and which is another odd thing when you get instructors in our field. Sometimes they're not humble at all, and they should be. They don't even have a right to not be. You have a right that you could be a little more arrogant, but you don't. You're not. And so I can see why you're so successful is because you're such a down to earth guy, and you're a good instructor. You're really good at explaining things, and so that's I can see, yeah, why you're.
Thank you very kindly. If God gives, God can take.
That's right.
So, who am I to be on any kind of a throne when I'm down on my knees in front of the one that counts on his throne? So my attitude is my gratitude. I will always remain humble, but I have a professional confidence that others misconstrue for arrogance. Look, confidence is because of competence. Those who fail with competence maintain a level of arrogance to hide their insecurities. I just maintain one thing, and that's I learn forever. I'm going to end on this note because I have patients coming in now, but I want to end on this one. The word you say humility. I would like you to know what I say from stage. The word doctor means how much I don't know. So I'm on a quest to fill my brain with as much knowledge as I can before my maker takes me home. And I want to dispel all of the information as a legacy, as a baton in a relay race in life, in chiropractic, to help your community that you're outreaching. Learn to become the best of the best. Go put the blood, sweat, and tears. If you're junior varsity, you want to be varsity, push harder. If you're varsity, but you're sitting on the bench and you want to be the first stringer, push harder, try harder. Who's limiting you but yourself? And don't forget, the windshield in life is bigger than the rear view mirror. Which way do you want to go? I choose to go forward, so I look at the bigger picture. Dr. Mike, you're awesome. What a great podcaster. I really appreciate all that you're doing for the profession, and for anything that I can reach out to help you at any time, please don't hesitate. Maybe we'll have a star on the show with me and we can have some fun.
That's right, Doc. Thank you so much.
Have a great day. Thank you.
All right. If you made it this far, smile.